future of health is what I'm to talk about. And in a kind of time-honored fashion, I'm going to start with the past and move towards that future. 150 years ago, in this part of Western Canada, cholera still killed people. And cholera was a pretty terrible disease. And terrible in the original sense of the word. It caused terror. And the reason it caused terror was because you could go from being perfectly well to violently ill to dead within hours. And people would do anything to try to get treatment to stop that from happening. And they did the usual things. They looked for the medications, for the pills, the potions. They tried the technology of the time, which included bleeding and magnetism. And most of that didn't work. Some of it probably killed them quicker. But they were desperate. The only thing that was known with any kind of reliability was that poor people tended to die in larger numbers than rich people did. But that wasn't very helpful because it was pretty widely thought that the reason people were poor was because they had weak moral fiber. And of course, if you have weak moral fiber, what are the chances you're going to survive disease? But luckily, about the same time, people started to discover that cholera was actually associated with water. And more particularly, it was associated with water that had been contaminated with sewage. So instead of trying to work at treatment and blaming the individual, what communities did was that they banded together and started to do a better job of collecting the sewage and treating the sewage and making sure it was safe before they discharged it back into the river. Just in case the town upstream wasn't quite as careful, they invested in water purification plants. And when those were put in place, not only the rich got healthier, but the poor as well. And we don't have cholera anymore because of the investments that those communities made together in prevention. 50 years ago, in this city, there was a polio outbreak that was raging throughout the city. Polio is a pretty terrible disease. It didn't seem like there was anything you could do about it. There's no treatment. There still is no treatment for polio that works. Nothing that cures people. The only thing that people had was a piece of technology that at the time when polio made sure that you were at your weakest, when your muscles were so weak that you couldn't breathe for yourself, if you were put into this piece of technology, iron lung, it could breathe for you until such time, not that you were cured, but that your immune system kicked in and you survived, often with crippling consequences. I remember the sound of my cousin running around the bases, clanking around the bases in Little League Baseball because of the braces he wore as a result of polio. So the iron lung was capable of keeping people alive, but in that outbreak in Edmonton, there weren't enough iron lungs to go around. And so they brought in student doctors and student nurses to use rubber bags to help people breathe for 24 hours a day, 7 days a week, until their immune systems brought them back. We don't have much polio these days, but it's not because of the iron lung, and it's not because of the heroic efforts of those student doctors and nurses. We don't have polio today because of a pretty innovative example of crowdfunding, which is another way that communities get together. And it was called the March of Dimes. And who doesn't love the king? The March of Dimes was a crowdfunding approach to finding something that would protect people from polio. And polio had its worst effects on the young. And so, boys and girls around the world sent sums of money as small as a dime from their paper routes, from their babysitting, and they were joined by friends and family and companies that funded the March of Dimes. And the March of Dimes funded research that resulted in the polio vaccine. And in today's world of the internet and crowdfunding, it's probably an example that's worth taking a look at. That vaccine is what's responsible for polio not being present in Edmonton today. And it's the reason that we're on track to eliminate polio worldwide. And when we made polio vaccine available, we didn't just make it available to the people who could pay for it. We made it available to everybody. And we did that because we recognized that none of us are safe until all of us are safe. About the same time as polio's story was dropping down, a new story was starting, and that was an increase in lung cancer amongst men. The epidemiologist who researched that increase thought that what he would find was that it was chemicals in the environment that were causing the increase in lung cancer. He thought maybe the asphalt that was used on paving roads after the Second World War was responsible. And when his research showed him what it was, he didn't believe it. And he's gone on record as saying that. And he didn't believe it because the cause, which was smoking tobacco, was so common, was so socially acceptable, was so widespread, he didn't believe that anything that was that socially acceptable could actually cause death. But it was tobacco that was causing lung cancer rates. And it's hard for people to imagine exactly how common that was. Back in the 60s in Alberta, more than 50% of adults smoked. They smoked not just in restaurants and bars, they smoked in hospitals. And cigarettes could be sold in pharmacies. Right, because they're dedicated to health. The part that the medical students I teach find incredible is that people were allowed to smoke on planes. They think that's amazing. 50,000 feet at least from the nearest fire station in a metal tube that has oxygen and flammable material and powered by the most flammable fuel on earth, and you let people smoke? I tell them it was okay because there was a no smoking section. That's exactly the response I got. The part that I find most incredible about that, though, is that when I lived it, it didn't seem that weird because it was there. It was just like cholera and polio, it was just something that happened. You just sort of accepted it until you didn't. Well, the treatment for lung cancer sucked then, and it's still not very good now. And so communities got together to do things to try to bring down the cause. And what they did were things like ban advertising to the young. They made sure that secondhand smoke bylaws got passed so that people who didn't smoke weren't exposed to the carcinogens produced by smoking. And they made sure that taxes increased faster than the cost of inflation so that people who didn't have a lot of money, like the young, weren't able to afford cigarettes. And those things have worked. We've gone from 50% smoking down to 20% in this province. It didn't come easily, though, and it's instructive to think about it a little bit because the story's different than it was with cholera and with polio. This was man-made. And we know that the tobacco companies, for instance, smuggled cigarettes into areas where the taxes were increasing so that they could sell cheaper cigarettes. We know that they knew that 50% of the people who used their product were going to die from tobacco-related diseases, so they had to replace them. And they also knew that if you don't start smoking before you're 20, you're unlikely to take it up. So they were advertising to kids, they were smuggling cigarettes, and we now know that they suppressed releasing the results of research that they had that showed that tobacco caused chronic bronchitis, emphysema, and lung cancer. And they did it deliberately. They used lawyers in court trials to try to suppress that evidence from coming out. They used marketing agencies to attack the medical experts and to attack their credibility. If cholera and polio had been able to afford lawyers and marketing agencies, we might be looking at quite a different world today. But in spite of those efforts, lung cancer rates in men are coming down. So in each of the three cases, we concentrated on prevention and we concentrated on community. But who are the people in the community that do that? Well, to show you that, I have to tell you a little bit about a group of people I met in St. Albert, which is a town community just outside of Edmonton. And I was asked by the Rotary Club to do a talk there on public health. And I asked them to send me some material on the kinds of things they do for community service. And I talked to them about three things that they were doing. One, like Rotary clubs around the world, the local Rotary clubs continue to fund Rotary Club International's efforts to eliminate polio worldwide. And they do that because they recognize that none of us are safe until all of us are safe. Country support for the polio eradication campaign is always at its strongest when polio still occurs within their country. And after it no longer occurs, the support drops off. But the Rotary Club support was there at the beginning, it's there now, and it will be there at the end when we finally eliminate polio. And so I congratulated them on that. I congratulated them on their school meals program, because the evidence is clear. Kids who are better nourished do better in school. Kids who do better in school get better jobs. Better jobs means better income. Better income means less diabetes and high blood pressure. But the thing that they were doing that really amazed me was that they were working towards creating a park in St. Albert. And parks are amazing places for health. Families go to parks with their kids, and particularly the ones that are between 0 and 5 years of age, benefit by running around, smelling the flowers and trees, rolling around in the grass, putting things that they shouldn't put into their mouth. Although in the next edition of Public Health, given the research we're saying, we may actually be recommending that because it looks like it's good for your immune system. But they run around and they play with other kids, and their families get to know one another, and the kids run around to ask questions of the seniors who've just finished their Tai Chi. And so the kids from 0 to 5 who are exposed to the natural world like that and the social interactions with other kids, that connection is mirrored by the connections of the neurons in their brain. They get what I like to call bigger, bushier neurons. My wife believes after this morning session I should get Fred Penner to write that song. So the bigger, bushier neurons result in smarter kids and more resilient kids. Kids who exercise early are likely to continue to exercise throughout life and will end up with less diabetes and less obesity. But it's the connecting where the real health happens, because kids connect with kids, families connect with families, and generations connect with generations. And the research is absolutely clear on this. As individuals, the more connections we have with friends, family, and neighbors, the healthier we are and the longer we live. As communities, the more connected we are, the safer and healthier the people in those communities are. So I congratulated the Rotary Club on the fact that they weren't just serving their community. They were doing the three things we value the most in public health. The polio campaign prevents disease. The school meal program makes sure that people are as healthy as they possibly can be. And the work that they do in parks, connecting people, is the kind of thing that means the entire community is healthy, which means the entire population is healthy. And those are the measures that have been responsible for the increase in life expectancy that we've had in the past 113 years in this province. The life expectancy used to be 50 years, and it's now more than 80. What about the individuals, though? That's what the group looks like that's doing something to increase health. Those are the people who work to improve our health. But what do the individuals look like? Well, if you're the kind of city councilor who insists on there being sidewalks in every part of your city, if you're the kind of dad who insists on the fact that insists on the family going out for an hour's exercise every day, and if you're the kind of teen who goes and shovels the walk of the elderly neighbor after a snowfall so they don't fall and break their hip, you're working for health in your community. If you're the kind of mom who insists that your kids get 5 helpings of fruit and vegetables each day, even though you know that they're being advertised 7 times an hour to consume high fat, high salt, high sugar food-like products. If you're the kind of person who insists on there being a farmer's market so you can get fresh fruit and vegetables and farm families who sell there can earn a decent living, and if you're the kind of grocery store owner who insists on locally sourced meat so it doesn't have to be salted and frozen, then you're building health in your community. If you're the kind of individual who donates their time to the inner city agency so that the homeless can find shelter, if your faith-based organization insists on feeding and clothing the poor, if you're a government official who insists that there be income support so that if people lose their jobs, their families don't lose their livelihood, then you're creating health in your community. And why is it important that the organizations that build health and the individuals who come together to create health know who they are? Why am I doing this talk? It's because we're facing threats like we've never faced before that may roll back the gains in life expectancy that we have worked so hard to get. We're facing threats that mean that for the first time in 100 years, that our children's generation may not live as long as their parents. And what are those threats? Well, childhood obesity. We have 8-year-olds who have high cholesterol level. We never used to test for cholesterol or any of the other risk factors in kids that young because they just weren't there, and they are now. We go to work and we work at workstations, and we come home and we play at playstations, and neither of those places do we get the exercise we need to live. Our bodies were made to be active. We were made to be active. And if we're not, we get sick. We have companies that are investing in the highest tech equipment possible to find the absolute perfect combination of sugar, salt, and fat so that the machines can show them that the pleasure centers in the brain light up when people eat those foods. And those are exact same places in the brain that light up when an addict gets a fix. Those are the kinds of threats that we're facing. But public health story has always been the same. The thing that we recognize is that about 16% of your health comes from your endowment from your parents, the genetics that you got from your grandparents and your forefathers and foremothers. Of the remaining part of health, twice as much comes from where you work, what your neighborhood is like, how connected you are to your community, how healthy your environment is, how healthy the food you consume is. And so what public health has always recognized is the power of coming together is what keeps us healthy. And in particular, the story of public health goes like this. It starts with a small group of individuals, sometimes as small as a single individual, who can dream of a world that's better than the one that they're in. They dream of a world without cholera. They dream of a world without kids crippled by polio. They dream of a world in which mothers and daughters don't die of lung cancer and aren't able to attend the weddings of their children. And then they get a small group of people who share that dream, and they strengthen one another's spirit, and they work together on a journey to make that dream come true. And so far, public health has always won. Polio is almost gone, cholera is gone from this country, and lung cancer rates are coming down, and we can beat things like childhood obesity if we work together. So I used the image of the cliff. I decided to get a locally sourced image for that one. Sorry. I had this head smashed in buffalo jump. And I've already used the metaphor that at the bottom is the healthcare system, which will patch up those who are wounded and reset the broken bones, will bury the dead, and will comfort the families that are left behind. But public health has always wanted to climb that cliff, and we need the people who are the true health workers in the community to help us scale that cliff. And so, the future of health, it's you.